शुद्ध देसी रेडियो शुद्ध देसी रेडियो सॉलिड कलेक्शन है सुरों के एक्शन है दिल से कनेक्शन है सॉन्ग सिलेक्शन है शुद्ध देसी रेडियो शुद्ध देसी रेडियो.
Hello everyone, my name is Priyanka Godigar, and today I'm here with Divya to discuss the correlation between VTE and pregnancy. To help us understand this topic better, can you tell us a little about what VTE is?
Of course. VTE is also known as venous thromboembolism, which is when a blood clot forms and blocks blood flow. It is a very serious condition.
That does sound dangerous, but what does VTE have to do with pregnancy?
Good question, Priyanka. While the two might seem different from one another, pregnancy actually increases the risk of VTE 4 to 5-fold over than in the non-pregnant state.
Wow, and is there a specific time when VTE may occur during pregnancy?
Yes, VTE may occur at any time during gestation, mostly during the first half of the pregnancy.
Interesting. Can you tell us about the incidence of VTE in pregnancy?
Sure. The annual incidence of VTE in the pregnant population is 0.1%, or 1 in 1,000. Between 1991 and 1999, PE, or pulmonary embolism, a thrombotic condition, was the leading cause of maternal mortality.
Can you tell us about VTE in pregnancy in recent years?
Sure. Pregnancy-related mortality has been increasing over the past several years. A significant percent of this number is from VTE during pregnancy.
With all these effects, there must be a time when VTE will occur more frequently than others. Can you tell us a little about some of the risk factors?
Absolutely. There are, in fact, many risk factors which include normal physiologic alterations during pregnancy, C-section delivery, in which the risk of VTE is twice that of vaginal delivery, maternal cardiac disease, and premature delivery.
Wow, this seems like a lot of risk factors. Are there any which don't specifically relate to pregnancy?
Yes. These include a personal or family history of VTE, the presence of a thrombophilic disorder, obesity, and thrombophilia.
That's interesting. Could you tell us about the physiological changes that might accompany VTE in pregnancy?
Of course. Pregnancy is a state characterized by Virchow's triad, which includes hypercoagulability, venous stasis, and vascular damage. Together, these factors lead to an increased incidence of venous thromboembolism.
With all these risk factors, there must be some warning signs or symptoms.
Absolutely. These symptoms can be nonspecific.
Can you tell us about some of the common symptoms?
Yes. Some common symptoms include mild tachycardia, shortness of breath, chest pain, cough, and edema. Some other symptoms include pain and swelling of the lower extremity due to DVT. Signs may also include dizziness, hypotension, loss of pulse, or even death in patients with PE.
What are some ways we can diagnose thrombosis in a pregnant woman?
There are several ways. One is by using a D-dimer, a tool used to identify a blood clot specifically for deep vein thrombosis. Another is by using imaging studies such as compression ultrasonography for DVT, and chest radiography and perfusion scanning for PE.
With the diagnosis, what can the patient do now that they know they have VTE? Or what can they do to prevent this from happening?
Well, Priyanka, there are many ways to manage VTE during pregnancy. One of these ways includes a therapeutic anticoagulation in the absence of contraindications.
Interesting. Are there any specific anticoagulants a person can take?
Yes, some common anticoagulant agents are indirect thrombin inhibitors, which include unfractioned heparin and low molecular weight heparin, also known as LMWH, and orally administered factor Xa inhibitors such as rivaroxaban and apixaban. A vitamin K antagonist to help would be warfarin.
Wow, those sound like a lot of ways to manage this condition. What are some complications of VTE that may occur in pregnant women?
Unfortunately, there can be quite a few complications to VTE in pregnancy. Warfarin, an anticoagulant, crosses the placenta and may cause fetal bleeding. For maternal complications, there can be major bleeding in patients as well.
Wow, that sounds very serious. Are there any other conditions pregnant women need to be aware of?
Unfortunately, yes. Pregnancy-related osteoporosis can be quite rare, but despite this, it can be a dangerous condition that causes severe back pain, height loss, and disability. The incidence of VTE is highest in the first 3 weeks of postpartum. It then goes down gradually.
Pregnant women truly are at a higher risk of clots. Is there anything the general population needs to worry about?
Yes, there can be heparin-induced thrombocytopenia, or HIT, a syndrome that occurs when antibodies of heparin, another type of anticoagulant, creates a hypercoagulable state.
Pregnancy in VTE seems to be a very serious case, but can it even happen to some of the most accomplished people in the world?
Actually, VTE can affect anyone. In this case, Serena Williams was affected.
Wow, Serena Williams is one of the most distinguished tennis players today, winning a total of 39 Grand Slam titles.
That's true. However, Serena Williams also suffered from pulmonary embolism, or PE.
What is pulmonary embolism?
Pulmonary embolism is a life-threatening condition where blood clots appear in the lungs. In fact, Serena spent nearly 12 months incapacitated by a cut to her foot which sustained till last July and by a pulmonary embolism discovered in March. However, Serena later revealed that the clot in her lungs had been life-threatening, saying, "I was on my deathbed at one point quite literally. I've had a serious illness at first, but I didn't appreciate that."
That is very serious. When did she realize she had PE?
It started when she was on her way to an Oscars party, when she realized that she was having trouble breathing, and her physiotherapist convinced her to go to the hospital. She said, "At first people said it would be fine, it would be all right, but it turned out to be a lot more serious."
What ended up being her diagnosis?
The doctors told her that she had several blood clots in both lungs. Many days she felt like she couldn't breathe and she had to have surgeries on her lungs. In addition, she suffered from a torn ligament and needed stitches in both feet, saying, "I kept walking and it was glass there. There was a massive puddle of blood and I ended up fainting."
Did Serena face any other challenges relating to VTE during her career until now?
Yes, in fact, she suffered from blood clots after an emergency C-section because of birth complications. Not only did she have to battle blood clots, but many of the nurses didn't believe her when she tried to ask for medicine for her blood clots.
How did Serena know that she had blood clots?
Serena Williams started to feel shortness of breath, and because of her history of blood clots, she immediately knew what it was. In addition, she was off her daily anticoagulants because of the C-section. She tried to tell the nurse that she needed a CT scan and IV heparin.
What did the CT scan show?
Actually, the nurse thought she was hallucinating from her pain medicine. Instead, they did an ultrasound of her legs and found nothing. Serena insisted on a CT scan later, saying, "I was like a Doppler. I told you I need a CT scan and a heparin drip." When they did the CT scan, they indeed found small blood clots in her lungs.
Wow, she had to deal with all of this only shortly after giving birth.
That's true, but she showed that VTE and pregnancy is very serious. In fact, an average of 150,000 women in America alone experienced some of the same complications Serena did. Though Serena survived because of her history of blood clots, 700 to 1,200 women die from VTE during their pregnancy. African American women are 3 times more likely to die from these pregnancy-related causes than Caucasian women. African American women averaged 40 deaths per 100,000 live births compared to 14 deaths for Caucasian women.
This seems to be a very big problem. Did Serena ever suffer from PE later?
Yes, she had another experience of PE in her postpartum period, but today she is very healthy and continues to be the accomplished athlete we know.
Archana, one of the past GTF members, conducted research on the thrombotic episodes in the Serena Williams case. Can you tell us some more about that?
Sure. Many believe that thrombosis isn't even an option for an athlete like Serena Williams, but Serena belonged to many high-risk categories for thrombosis. She was a female, and thrombosis is more common in females. Some other factors include her use of oral contraceptives, pregnancy, a prior episode of PE, and C-section, which doubles the chance of developing a thrombotic episode.
Through all of this, I have learned that thrombosis is a very serious condition that can attack at any time and to anyone, as we saw with Serena Williams. It is also important to note that each pregnancy carries a certain amount of risk for thrombosis.
Yes, but if a pregnant woman maintains a healthy lifestyle, food intake, and an exercise before, during, and after the pregnancy, these risks could easily be avoided.
VTE during pregnancy is very serious, but it seems like it is definitely preventable.
Absolutely, Priyanka.
Thank you so much for helping us to understand more about pregnancy and VTE, Divya.
Of course.
We hope that you have learned more about this topic and can recognize the symptoms, risk factors, and management methods. Thank you for your time.
देसी रेडियो सॉलिड कलेक्शन है सुरों के एक्शन है दिल से कनेक्शन है सॉन्ग सिलेक्शन है शुद्ध देसी रेडियो शुद्ध देसी रेडियो